Now, one of your current responsibilities is to serve as the incident coordinator for Australia's National Incident Room. What core strengths do you believe that, on the one hand, you possess that best enables you to serve in this capacity? And perhaps as a follow-up to that, what do you believe core strength in general for anyone that would be given this responsibility?
Okay, it's really interesting. The answer that I probably will give will be the answer that is most reflected upon by others who share with me what they've appreciated from me in times when we've been activated either in the NIR or in other parts of my career. And that's basically a calmness to my demeanour, and the ability to always put a smile on my face no matter what the situation is. Sometimes that comes naturally, or hopefully most of the time that comes naturally. Sometimes it's deliberate, despite what's going on around. And I think that the thing that most of my colleagues have appreciated is that no matter how stressful it's been, no matter how busy it's been, no matter what the inputs have been, whether it's been from a political perspective or from our colleagues in the states or territories, or whether it's been media, I've always made sure that in the face of my colleagues, particularly those who report directly to me, that I appear calm and stable in that respect. I think the other strengths that I have are an ability to prioritise quickly and to understand the political dimension, and that's particularly important at senior levels and at high levels. At more junior levels, it's really important to be able to prioritise. It's really important to be able to know what you need to do now, what you can delegate, and what you can leave to a little bit later, knowing, of course, that you should never leave something to another day unless you have a plan for that. I think it's also important to understand your personal limitations. Right. I can work long hours, but I know that when I'm tired, I do need to stop. And one of the things that I've seen in others that I've taken on board is that ability to be able to say to those that I report to, look, I'm not effective anymore, I need 6 hours. I may not sleep, but I need to be away from this place, and I will come back fresh. And I think it's important to understand your limitations physically and also mentally. The other thing is that we see around us a number of people who have very strong skills that they've learnt in terms of management and leadership, but their knowledge base may not be as strong. And while I don't want to sound conceited, I think that I can bring to the position a reasonably broad knowledge of the area that I look after. And coming with that is experience. There's really no better guide than experience. If you've experienced something once, and even if you failed it at the first time or didn't accomplish the mission as well as you might have hoped, you know that the second time, the third time, and subsequently you'll do better. And so putting yourself in a position where you're continually learning is also really important. And I suppose the last thing that I see as a strength is knowing people, is knowing who to contact in the right places in the states or territories or within government agencies, and now it's becoming more important to know the key contacts in other countries, and there are a number of your colleagues, Key, who I've made contact with and have become close with, and I think that's really important in terms of the way we look at security from a national perspective for Australia, the US, and other like-minded countries.
Dr. Lim, one of the greatest challenges to disaster response, I think, is effective coordination. And your role as the incident coordinator for the National Incident Room, you're responsible for overseeing the activities of many different government departments and agencies. What have you found to be the primary key to defining a central goal and in coordinating an appropriate response with so many different actors?
Okay, See, I think this comes back to some of the elements that I mentioned before, particularly around knowledge and knowing limits. So for what we do, a good understanding of knowing what our exact role and mission is. So within Australian government, our role is health. It's really important that we don't overstep those boundaries. It's really important that we cover off completely what is expected of us within health and that we don't lose anything there. With Victorian bushfires, while there was a rapid response from first responders, health became involved because we were interested in the mental health side of things, the aged care side of things, the primary health side of things, as well as the acute care in terms of hospitals and burns treatment. But sadly, most people who were burnt either succumbed or they had mild injuries. And so it's ensuring that we know what our complete mission is. I think number two is that we understand that, at least within a federated country like Australia, and I understand it may be similar for colleagues in the United States and other federated countries, the states, territories or provinces are responsible for the delivery of operational mission goals. And from a national perspective, our role is to coordinate and support those colleagues in the states and territories and to support the role of our departmental executive and our ministers or the political masters that we may have in responding to a health emergency. Mm-hmm. When I look at my role within the National Incident Room, it's really to ensure those objectives are met by working closely with my bosses, my supervisors, my senior executives, as well as state and territory colleagues, so that the teams that are working within the incident room can work effectively and efficiently. And I see myself more as an interface, and that's probably one of the key things that I've taken from my role as a clinician and working in laboratory medicine to the role here. In laboratory medicine, I saw myself as an interface between my colleagues working in the laboratory, providing diagnostic answers to clinical questions, and the interface to clinical colleagues and the patient sitting in a bed in the hospital or sitting in a bed at home waiting for an answer on a question that's been asked that only the laboratory can answer. So I see myself as that interface, being able to communicate in two ways. So one of the things I need to do is constantly remind myself of what my task is, so that I can make it easier for my superiors to do their job seamlessly and without any apparent fuss. My aim in life is not to be known as anybody, but to lead the group that I've been charged to lead and to ensure that the people above me do their job as easily as possible. And if I can help them do that, then basically my job is done.